Now here in Colorado, there is another problem. As cases of respiratory illnesses rise, UCHealth says it's dealing with a shortage of respiratory therapists among other roles in the hospital.
9 News reporter John Glasgow joins us live outside UCHealth in Aurora. And John, hospitals adjusting staffing, but they're also creating a program to treat the people on ventilators.
Yeah, and that's because respiratory therapists are in high demand right now. The pandemic burned a lot of them out and they left the industry, and enrollment is also down 27% since 2010. That's according to the National Board of Respiratory Care. So UCHealth has come up with a new way to monitor patients who are on ventilators.
They can kind of be the eyes in the sky at a 30,000-foot view, helping the people that are boots on the ground caring for our patients.
So UCHealth has created a new position called a virtual respiratory therapist. They say it's a way to provide a new layer of support for patient care. A licensed respiratory therapist is monitoring the data of all the patients on ventilators in what looks like a virtual command center. This is a way if a patient needs to have a respirator cleaned or maybe the settings adjusted, they can alert the staff in the hospital to make those changes quickly. They say it streamlines their workflow and helps get the patients off of the ventilators faster.
If the patients that were a higher acuity, they're the ones that we're being focused on. And so the patients that were doing better, trying to figure out how can we go ahead and, utilize other job roles, other people to help with getting these people to the, getting them off the ventilator when they're ready.
So it's a way that they can go from the floor up to that command center and back. They do a little cycle there with their staff. Now they can monitor up to 35 to 40 patients right now here this morning, but that can jump up to 60 if there's more COVID cases or potentially the flu season and people need to go on a respirator. Now this is something that we're seeing in the wake of the pandemic. It's really tested hospitals. So now we're starting to see the ripple effect and how they're using new technology to help things happen a little bit more efficiently and effective here in hospitals like UCHealth behind me.
Yeah, and with all the unemployment shortages and situations like that, I'm guessing we're just going to see more and more technology in other parts of the healthcare system too.
Yeah, absolutely, Gary. We're seeing this in all kinds of different areas. In fact, UCHealth says it's not just respiratory therapists as well. They're short in all their areas of the hospital, and they're trying to find the best way to get things done with the staff that they have.
All right, interesting story. Thank you.